Hello, and welcome to our Obstetric Educational presentation. This video has been developed by the Pelvic Health Physiotherapy team at Ashford and St Peter's Hospitals and our Jess Foundation Trust. Up to 70% of women in pregnancy experience lower back or pelvic pain. Pelvic girdle pain, previously known as symphysis-pubic dysfunction or SPD, is an umbrella term which describes pain in your hip, glutes, or pubic area. This session has been created to help you manage with less pain and discomfort in pregnancy. During this presentation, we're going to discuss pelvis anatomy, some of the changes that happen in your body during pregnancy and how they can contribute to your pain, what strategies you can use to manage your symptoms, and what happens if things don't improve. If you look at the picture in the bottom left, you can see that your pelvis has three bones, your sacrum at the back and your two ilium at each side. These bones connect at the back, creating your sacroiliac joints, and at the front, creating your symphysis pubis. Your pelvis then connects to your hips and to your lumbar spine. Your hips and lumbar spine are able to move over a large range. Your pelvis acts as a strong, stable structure that doesn't allow much movement but offers a great deal of support to this area. To keep your pelvis stable, there are several ligaments, which are rope-like structures that work like strong elastic, providing support and some limited movement. These help to protect the pelvis from too much movement that can cause pain. You can see these ligaments and how many there are offering support in the top right picture. As you can see in the middle picture, the baby is surrounded by your internal organs and your rib cage that protects your lungs and your heart. A key group of muscles that provide support during pregnancy are your pelvic floor muscles. These muscles sit at the base of your pelvis. They run from the pubic bone at the front to the coccyx at the back, and they spread sideways to your sitting bones. They support all the contents of your tummy, your bladder, your woman's vagina, and your rectum, and currently, while you're pregnant, your baby as well. They are responsible for maintaining your bladder and bowel continence, providing adequate support for your tummy organs, providing satisfaction during intercourse, and they help assist baby's position in the birth canal during labor. They also work alongside your tummy and bottom muscles to help provide stability to your back and pelvis. During pregnancy, as baby grows, these muscles have to deal with an increase in pressure and can get gradually weaker. As your bump grows, your center of gravity is shifted forwards, and this changes the way your muscles work and the way you move. Your weight increases, and it is normal to gain between 22 to 28 pounds or 1.5 to 2 stones. This will often put further pressure on your joints and muscles. As your baby grows, there is less space for your ribs to expand during breathing, and your breasts also get bigger. This can impact on pain and discomfort around the upper back and rib cage. During pregnancy, your hormones change, and a hormone called relaxation increases in the body. This causes your ligaments to get softer to prepare you for delivery. This can affect the stability of your joints, particularly in your pelvis, but can also affect other joints. With all the changes happening in a small amount of time, it is normal that your muscles have a hard time adjusting. Your tummy muscles and pelvic floor can get weaker with the increased load from baby's growth. Other muscles must kick in and compensate, and this can make them overworked and tight, which can also lead to pain. There are some factors that can increase your risk of having pain during pregnancy. Increased fatigue in pregnancy because you're not having enough breaks or rest. This could be exacerbated by a chronic condition like chronic fatigue syndrome. This can make your muscles more tired and less able to cope with changes. If you have previous history of pain, particularly persisting pain, this can cause increased nerve sensitivity to pain. Having had a trip, a fall, or accident in the past can leave the area affected vulnerable to further pain. If you are hypermobile, your ligaments are naturally softer. This, alongside the hormonal changes that occur during pregnancy, can impact further on pelvic and back pain. And finally, if you have multiple pregnancies, your body can struggle a bit more to recover each time. So what can you do to help? Engage in gentle exercises your pain allows. Muscle, joint, and ligaments are mobile tissues, and they tend to recover best when strengthened or stretched. Research has shown that gentle exercise can reduce pain levels and help us to manage the pain better throughout the pregnancy. Pace yourself through the day, plan your activities for the week, spread them evenly through the days, and take regular breaks to avoid flare-ups. For example, if you need to diet up a harm, plan to do an hour every day over a week, and after half an hour have a break to move around or have a rest. When possible, avoid activities that aggravate your symptoms like lifting, standing for long periods, or walking long distances. As you may have noticed already, your medication options are more limited in pregnancy. Unless you have been told otherwise, you can safely take paracetamol in pregnancy, but any other medications you will have to discuss with your GP. You can opt to use ice or heat as pain relief instead. Ice is a great anti-inflammatory, and you may want to use it in your pubic bone, hips, and sacrum. While heat helps relaxing tense muscles, you can choose to use it in your lower back muscles, glutes, and inner thighs. You can use ice or heat 4 to 5 times a day for 10 to 15 minutes, but make sure you're careful when using it and don't put it in your bump. Make sure you wrap it in a towel or tissue so it's not directly on your skin. You can choose to go for a pregnancy massage or ask your birth partner to give you a regular massage. Lying on your side, leaning on a table with pillows to support you, or leaning on a gym ball can be comfortable positions for a massage. Alternatively, you can use a foam roller or a tennis ball to massage your lower back and glute muscles, or your thumbs to massage the top and inner thighs. As your bump grows, it causes your center of gravity to shift forwards, and this puts your muscles in positions where they're not working as effectively as before. Being aware of the way you stand or sit can help to counteract this, and it means your pelvis and lower back are better supported. While standing, remember that your back and bottom muscles are often overworked and tight. By standing in an incorrect posture, you could be straining them even further. To avoid this, gently tuck your tailbone underneath you while squeezing your tummy muscles slightly. Make sure you don't lock your knees. Have your feet slightly apart, distributing your weight evenly between both legs. While sitting, bring your bottom all the way against the back of the chair or sofa. Keep your knees at the same height of your hips or slightly lower by placing a small towel at the back of the chair. You can also place a small rolled towel or cushion behind the curvature of your lumbar spine. The safest position to go to sleep is on your side, either left or right. Research recommends avoiding sleeping on your back after 28 weeks. This can be difficult when you have pain, but we will talk through some other sleeping positions that can be useful. Try to use pillows to make you more comfortable. You can use as many as you want, and you don't have to buy any special pillow. A good tip, if you like your pillow in a specific shape, is to tape it into the shape so you don't spend time shaping it at night. Don't worry if you wake up on your back. The research looked at positions women fell asleep, and this is the position we keep for longest. If you wake up on your back, you can turn over and go to sleep again on your side. You can start by placing a soft, thin pillow or duvet underneath your hip, as this will take some of the pressure off the hip joint. You can also place a thin pillow or roll towel underneath your bump, as it gives support and reduces pressure on your back and pelvis. Place a pillow in between your knees, right up to your pubic bone, making sure you keep your knee at the same height as your hip and pelvis. You might need 2 pillows. To support your shoulder and chest, you can place a pillow under your top arm in front of your chest. You might also try to use pillows to change your position when it's too painful to stay on your side. You can place pillows behind your back or on your front if you're in a halfway position. In the following videos, we're going to show you some ways to help you move better and reduce the strain in your back and pelvis. Getting in and out of a car. When parking the car, if possible, try to find somewhere that allows you to fully open the door. To make it easy to get in and out, you can place a plastic shopping bag in your seat beforehand. Then you can hold the side of the car and lean forwards to sit down. Squeeze your lower abdominal muscles to twist your hips and roll the legs into the car, keeping your knees together. To get out of the car, roll your legs out, keeping your knees together and squeezing your lower abdominal muscles, then lean forward and use your hands to get up. Turning in bed. When on your side, bend your knees up and together, then squeeze your lower abdominal muscles to roll your knees, using your hands for support and pushing through your heels to help lifting your pelvis over onto the other side. Getting in and out of bed. To lay down, sit on the side of the bed and go down on your hand and elbow. Then squeeze your lower abdominal muscles and swing your legs up into the bed, keeping your knees together. To get out of bed, keep your knees together and swing them off the bed and push yourself up with your hand and elbow, squeezing your lower abdominal muscles. Lifting. Avoid lifting as much as possible. If you need to lift something, place a foot near the object you have to lift and kneel onto your knee, bending from your hips and knees and keeping your back straight. Hold the object close to your body and use your legs to push you up, squeezing your lower abdominal muscles. If able, hold on to a chair or table to help you get up. If you have other children that need to be lifted or carried, ask them to step into a sofa, chair, or the bottom of the stairs so you avoid bending as much. Getting in and out of a chair. To sit down, feel the back of the chair with the back of your knees. Lean forwards and bend from your hips and knees to go down while squeezing your lower abdominal muscles. To get up, have your feet hip wide apart and your heels underneath your knees. Lean forwards and push up through your heels, squeezing your lower abdominal muscles. Use your hands to support either on the seat or on the arms of the chair. A few of the tips are wearing comfortable shoes that have a thick enough sole to absorb the pressure of your foot hitting the floor and that provide enough support around your ankle. Don't wear high heels because they shift your weight forwards, which alters your balance and posture. Use a well-fitted, non-underwired maternity bra with wide straps to support your back. Women often need to be refitted for their bras as their breast size changes during pregnancy. Make sure objects that you use often at work are accessible, keeping them close to you so you don't have to reach, twist, or bend to get them. Try to also apply this to your home situation with clothes, home and kitchen supplies, storing them at your shoulder or chest height. When getting dressed, make sure you don't stand on one leg and sit down to put on jeans, leggings, socks, or shoes. Take your time and accept help when possible. It is important to understand that often no one change or technique will help you on its own. Symptoms will be more manageable with a combination of strategies, being consistent and kind to yourself. Physio can help, giving you specific advice for your pain, guide you through strengthening and stretching exercises, and exercise to improve your posture. A physiotherapist can assess whether a maternity belt, Tubigrip, or crutches may be of benefit to help manage your pain. For most women, this simple management advice can make a significant difference to pain and function in pregnancy. If you try this advice and it does not change your symptoms after 1 week, please contact our team for a follow-up appointment at any stage during your pregnancy. For some women, they can find an external support for their tummy can help improve discomfort. One option is Tubigrip. This is a very stretchy piece of fabric that helps give extra compression and support to your back and pelvis by holding some of the baby weight. You can wear it all day and night and in any position. You've been sent a separate document where you can find online links to purchase a Tubigrip or a belt. This is a size L Tubigrip. This is the biggest size you can get for maternity. When you order it online, you get 1 meter of Tubigrip. And you can use your hands to roll it up like a pair of tights. Sit down and get each foot through the Tubigrip and roll it up to the mid-thigh. After you stand up, grab the top part of the Tubigrip and roll it up all the way to cover your bump. You can tuck it under your bra to stop it from rolling down. Then grab the end and fold it over again so you end up with 2 layers of fabric. The bottom of the Tubigrip should fall on your pubic joint and the top just under your bra. You can use it directly on the skin or over a top, and you can wash it by hand. A support belt is stronger and thicker than Tubigrip and gives extra support and compression, but you shouldn't use it when sitting or laying. It is for standing and walking only. You can get this belt using the links that we provided you. This is the back and middle of the belt. The belt should be placed high at your waist where your back dimples are. Then it should be strapped under your bump. You will notice that the back of the belt is slightly higher than the bottom. The belt has 2 extra straps that can be adjusted at each side to offer more compression. This won't harm the baby. The belt or Tubigrip will give you a nice sensation of comfort and support, but it won't make your symptoms disappear. And you may notice, as your bump gets bigger, that the support is not as effective. Because of this, it is important to use a combination of different strategies, as this will be the best way of managing your symptoms. We now know that our pelvic floor muscles get weaker during pregnancy, so we recommend all pregnant women to do pelvic floor exercises, particularly if you suffer from back or pelvic pain, since these muscles will help with your pelvic support and stability. Sitting, standing, or laying comfortably, slowly tighten the muscles around your anus and vagina, lifting up and in as if trying to stop yourself from passing wind and urine. To help build endurance in your muscles, contract your pelvic floor and squeeze for as long as you can. Then relax and release fully for the same amount of time that you held the squeeze. Repeat up to 10 times. The muscles need to be able to work quickly and as strong as possible so they can react to stresses like coughing, sneezing, or running. Imagine the muscles are an elevator. Lift up the muscles to the top floor as quickly as you can. Relax fully. Repeat up to 20 times. Try to remember these exercises by using a memory trigger, such as when you're washing your hands or after you go to the toilet. Or you can download the Squeezy app to help you remind you to do these daily. Remember to keep relaxed when you're doing your pelvic floor exercises. Try to avoid tightening your buttocks, squeezing your legs, or holding your breath. A feeling of gentle tightening in your lower stomach is normal. Try to complete these exercises 3 times per day. Sometimes counting out loud can help you if you're finding you tend to hold your breath. Your abdominal muscles will usually get weaker during pregnancy. This happens because, as you can see in these pictures, they have to stretch out for baby to grow. As they are stretched, they often become weaker or do not work as effectively as before. To keep your muscles strong, but also to support your back and pelvis and reduce pain, you can use your deep abdominal muscles more often. They attach to your pelvis and pubic bone. You can find them by placing your fingers on the bones that stick out in the front of your pelvis below your belly button. If you move your fingers in and down slightly and cough, you'll feel them move. You can imagine you're trying to fit into a tight pair of trousers and draw your lower tummy towards your spine. You can do this exercise regularly by practicing holding in for 10 seconds and repeat 10 times. But more importantly, you should tighten these muscles as you move, turn in bed, sit to stand, climb stairs, or lift something. Like we explained before, some muscles will compensate and overwork and get overtight. There are several beneficial stretches you can do to keep these muscles happy. For all the stretches, hold the stretch for 25 to 30 seconds and repeat 5 times on each side, up to 3 times per day. The first one is for your glutes or piriformis muscles. You can stretch these muscles in different positions depending on your flexibility, but the easiest way is sitting, crossing one ankle over the opposite knee, Straighten your back and lean forwards until you feel a stretch on your bottom. Usually one side feels tighter than the other, but we advise to stretch both. Do not do this stretch in sitting if you have pubic joint pain. To stretch your back muscles, sit or stand and raise one arm up over your head. Then lean sideways, keeping your head facing forwards and not twisting. Try to keep the foot or thigh of the side you're stretching rooted to the floor or chair. Repeat on the other side. Another muscle that sometimes gets overlooked is your hip flexor at the top of your thigh. You can stretch this muscle standing in a lunge position, moving your hips forwards and tensing your abdominal muscles. You can also kneel if able and lean your pelvis forwards. Repeat this stretch on both sides. Another useful tool is a gimbal, as this can be useful to facilitate your stretching. Strengthening your abdominal and glute muscles can feel comfortable to rest or sit down or to lean to receive a massage. If you choose to get one, there are no specific parameters for pregnancy. We would suggest measuring the height from your knee to the floor and get the ball size just above this measure. This will make sure it's not too low to sit. Pregnancy can have its stressful moments, even without adding any other external factors like pain. So it is very important to find moments every day to relax, even if it's just for a few minutes. Find your own way of relaxing because it will help you to cope better with all the changes happening. Help your muscles to rest and reduce stress and pain awareness. So how do you relax? A few examples are having extra breaks, a nice treat and a film or a book, doing some breathing exercises or mindfulness, listening to some music or having a warm bath, and exercising regularly. Whatever it is, start now. It can help you feel better. Thank you for your time, and we hope this information will help you manage better.